I'm Mannur. I'm a bariatric surgeon, and I've been practicing bariatric surgery since 1998, almost 23 years now, and also set up the biggest department of bariatric surgery in the country in Homerton in 2003. And I do mainly now bariatric surgery almost exclusively, and the surgeries I generally deal with is gastric bypass mainly, and to an extent sleeve, and to an extent band also. But there are many patients now coming for diurnal switch and SADIs, either for biliary reflux or even obesity, both ways. There are many patients now coming for revisional operations where the bariatric surgery fails the first time, like if they had a gastric band or even a sleeve or even gastric bypass, and they need a revisional operation as a second operation to bring down the weight again. Sometimes they may come for complications even, and they're not able to sort out. It could be from this country or different countries, in fact. Most of the patients we get are around 150 kilos generally. It could be 250, 300, or sometimes maybe 100 kilos. It depends upon their BMI. More than that, it is their waist line actually. If their girth is more and they have more comorbidities, especially diabetes and blood pressure. Some of them have exclusively with the sleep apnea, which is a real killer. And these are all almost disappear after the surgery. Some immediately, like the diabetes, some after 3 months, like the sleep apnea, or blood pressure, probably by about 6 months. And we're able to do these surgeries now fairly safely, and the morbidity and mortality is much less than even gallbladder surgeries now. In fact, the pain is very little in these patients. By 2 days, hardly they have pain, and by the end of the 1 week, they should be able to do most of the activities what they have been doing before the surgery. And then they start increasing the exercises, and by end of 2 weeks, they should be able to do full exercises and also swimming even. And we want them to do that, not only they could do, it is important they do the muscle toning exercises, because this will improve their muscle mass and also the toning of the skin. Most of the people are able to go to work by about 2 weeks. There are people who went back to work by 5th day even. It depends upon each individual is different, and we are all different people. Most of the time the hospital stays about a couple of days, and that's about it. And most of them have the blood tests, including vitamins, everything before operation, and probably about 6 months after operation. Follow-up is crucial, and communication with the team is important. Bariatric team has surgeon, the bariatric nurse, and the bariatric dietitian. Any one of us can help them if they have any problems. Sleeve is the most difficult operation to cope with mentally, because they have to be on liquid diet sometimes. Usually we say about 2 weeks for most of the operations, but they may have to be on liquid diet for about 4 to 6 weeks. And it's a more restrictive operation, therefore it's very difficult for them to cope with. And bypass is much easier because the food goes easily, because there is no valve to stop it now anymore. But the sleeve will usually tend to lose weight similar to the bypass by 3 years, almost similar, but then they start diverging, because sleeve people are able to eat slider foods easily, and which is basically the carbs, chocolates, biscuits, cakes, and that sort of things, and they can put on weight. Whereas the bypass people start putting on weight if they start eating more food. And that's why the revision may be necessary. But it is all a new lifestyle, and they have to change their lifestyle and the mindset, otherwise they don't improve. Surgery in the sleeve, basically you take out 3/4 of the stomach, and there is no change in the anatomy, whereas the bypass, you have the rerouting of the bowel and you have only thumb-sized stomach, but it expands with time. That's why nowadays we put even a ring to that so that it doesn't expand too much. Diurnal switch is for very big patients. If the sleeve fails or if their BMI is more than 60, then diurnal switch or SADIS operation, where the bypass is performed at the duodenum level and the stomach is complete and untouched. And that gives a good result, but nutritionally they could be very deficient unless they can stick to that diet, especially protein, vitamins and minerals. It is not for them. Sometimes diurnal switch, nowadays more people are coming because of the bile reflux post cholecystectomy syndrome, and they will be suffering for years, and then we do the diurnal switch. Recovery is very quick. Within 1 to 2 days they can go home, and by end of 2 weeks they're almost normal, eating wise even, and that seems to have a very satisfactory result for non-obese or obese patients with reflux. And generally the bariatric surgery doesn't need an intensive care, but it is better if we have an intensive care in case they have a problem, especially if they have a CPAP or diabetes or their BMI is more than 50. It's better to be in a place where there is ITU support.